Hi, this is Eric Greb, editor of Neurology Reviews. I'm at the ACTRIMS 2018 Forum in San Diego with Dr. Adil Harroud, neurology resident working in Brent Richards' lab at McGill University in Montreal. Dr. Harroud has studied the potential relationship between age at puberty onset and risk of MS. Dr. Harroud, what previous evidence suggested that there was a potential relationship between these two factors?
Yes, so first of all, Eric, thank you for giving us the opportunity to present our research. So there have been previous studies that looked at this association, and the largest studies were a Canadian study, a Danish study, and a US study that was as early as 1989 that found an inverse association between age at puberty and risk of MS. Most of these studies looked at women more than men. But what they found is that a 1-year increase in age at puberty was associated with a 10 to 13% reduction in risk of MS. There have been other studies that looked at this association. There have been studies in France, in the Faroe Islands, in Israel, and these other studies have not found any association between the two variables. The French study even found an association in the opposite direction. That said, the studies that did find an association were perhaps the largest and the most well-conducted observational studies. So there is, I think, good evidence to suggest that there might be a link there.
Could you please describe the Mendelian randomization approach that you took to study this potential association?
So what Mendelian randomization does is use genetic variants which distribute the population in different groups based on their genotype. And these groups will have different levels of age at puberty or BMI, which will allow us to then compare these groups based on their genotype and avoid several of the confoundings that would otherwise be present. So this is what we did in the study. We looked at genetic variants that influence age at puberty and their association with risk of MS. The genetic variants for age at puberty were derived from a large GWAS of 330,000 women. And because there is a very strong overlap in the genetic architecture of puberty timing in both men and women, these variants allow insight into the puberty timing of both men and women. So we were able to look at both. And using these genetic variants, we used a large data set of genotyped MS patients, 15,000 MS patients and 26,000 controls. And we're able to, using again these genetic variants, look at the association between genetically determined age at puberty and risk of MS.
And what were your results?
So what we found is very similar to the large observational studies. We found an inverse association between age at puberty and risk of MS, meaning that people who had a 1-year increase in age at puberty, on average, had an 8% lower risk of MS. This very much reproduces what the observational studies had shown and shows how these studies can be complementary to them.
Did you identify any potential confounders?
So we found that obesity is an extremely important factor in the association between age at puberty and MS. And I'm not sure if it's best thought of as a confounder, as a mediator, but what we found is that if we control for the effect of genetically determined BMI, using again Mendelian randomization and what we call multivariable Mendelian randomization, we were able to show that the association between age at puberty and MS completely attenuates once we control for the effects of obesity. So it seems that the observation of an association between age at puberty and MS is driven almost exclusively by the association between BMI and MS. So it really seems like weight status is the most important factor in this association.
What are the clinical implications of your study?
I think that this study showcases how the role of obesity in MS and in many other autoimmune diseases is important and has been perhaps overlooked in previous decades. So I think that what we're looking into now is how does obesity relate to MS? What are the pathways that it uses? And in another study that we've presented at a poster during this conference, it does not seem to act through vitamin D, so we have to find the other important pathways through which obesity influences risk of MS, and perhaps these can give us insight into the pathophysiology of the disease and uncover new mechanisms that could be targeted for treatment.
Thank you very much for your time, Dr. Harroud.
Thank you.